Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. Join Helping Seniors Television for an engaging discussion about your eyes, your vision, your health, and hope. Learn about groundbreaking new technologies and insights that offer great hope that your vision can be maintained and even improved. Dr. Hetal Vaishnav of the Eye Institute joins our program with this helpful and optimistic report. I'm Kerry Fink with Helping Seniors Television. I'd like to welcome you to today's program. What an honor it is to be here. I have the privilege of sitting in for our founder and president, Joe Steckler, and really honored to have as our guest today, Dr. Vaishnav from the Eye Institute. And welcome to the show.
Thank you for having me on the show again.
Yeah, you have done some amazing television work together with Joe over the years. It's brought a lot of hope and a lot of great ideas to people who may be concerned about their eyesight. So with that in mind, we're going to title today's show, Your Eyes, Your Vision, Your Health, and Your Hope. And actually, when I think about it, maybe hope is the most operable word in there, because is there hope for someone that is starting to understand that their vision is degrading and they're slowly losing eyesight over time?
Absolutely, Kerry. Vision, when people start to lose vision, whether it's from macular degeneration or diabetes or many of these chronic conditions, there is hope there's hope of saving their sight. It's very disconcerting for most people because loss of vision is such a personal thing. Sure. It is such a scary thing to have happen. And I get asked all the time with patients, doctor, you make a diagnosis of macular degeneration and they say, well, is this it? Is this how I'm going to go blind? And I tell patients, no, there is always hope. Our eyes are amazing. They are amazing organs and they're designed to fix themselves. However, sometimes our body overdoes what it needs to do and starts to damage the organ. Macular degeneration is a prime example. In patients with macular degeneration or even with diabetes, the natural processes of the eye that are supposed to be the defense mechanism become overactive and it starts to damage the tissue and people start to lose vision. We live in an amazing time. There are amazing new things, technologies that are coming down the pipeline. And oftentimes I tell patients that even if we can't fix your eyes today, it is important that we keep the vision stable and the eye stable so that the new things that are coming down the pipeline in a matter of few months and few years, your eye can use and we can restore sight. So this is an amazing time to be hopeful about eyesight.
I was thinking about that because before we were rolling the cameras, I was asking you that question. I said, we've done shows because the Eye Institute has been part of the Helping Seniors family since Joe started the organization, and we're now, I think, in our 8th or 9th year. And I was asking, there's a whole library on the Helping Seniors website. You can access them on the Helping Seniors YouTube over the years of some terrific programming about eye health and the things that are available. And I remember asking you, I think one of the shows now, it seems like new things are coming out almost every 6 months or something that may have been impossible. Now there's a way to approach it that you just didn't have available to you even some time back.
Absolutely. And in fact, some of the things that we can talk about, if they reference back to some of the videos, we're going to build on these things. Good. And, the way technology works, the way ophthalmology works is we build on the progress that we made before. And so, for example, these injections that we give for macular degeneration, we've talked about these in some of our past videos. Well, now we have learned a lot more about how to give these injections and how to treat patients based on our experiences from the past. So a lot of these things do build up on themselves. And I think your library, your video libraries are an excellent reference.
Yeah, I was going to say, we're blessed to have so many good programs in there on so many different topics. I think there's been everything from just dry eyes to more serious things, like even when Joe had his cataract surgery. I think we even were there in the Eye Institute filming all that. And it was interesting to go through that process just because so many people, I guess it must be you must be very used to it, but most people, when they think about their eyes, they probably approach it with a great sense of trepidation, like, oh my goodness, I'm so scared, I don't even know what to do. How do you talk to people about that?
And you're absolutely correct. I think fear is a big part of vision loss. And if they've done surveys, if they've asked patients or people, what would you rather have? Would you rather have a heart attack or vision loss? And most people say, well, I'd rather have a heart attack, not vision loss.
Wow.
I've had patients tell me that if they go blind, they'd rather not be alive. And our vision connects us to the world. Our vision connects us to everything that we do. And to lose that is a very scary thought. So I think the first thing I always tell patients that when we make a diagnosis, say it's macular degeneration or diabetic retinopathy, I tell them, look, you have a condition that we have seen in your eye, and we need to take active steps in treating it. And if we are active in treating it, and if you, the patient, partners with us and can be compliant with the treatments that we lay out for them, then they end up having a good prognosis. One of the things, as we just discussed earlier, if we can keep the eyes stable enough that the patient can retain whatever they have and not lose more vision, then there may be amazing things in the future that they can utilize, like stem cells, some of the newer nanotechnology things that are coming down the corner here. These things will help them regain some of their sight that they've lost.
Yeah, and that's it, isn't it? That people being active about this and maybe, like you said, taking some fear out of it. And that brings me to a question I was going to ask you about. You've developed a program that you call Healthy Eye, or Healthy Eye with an I. And I was going to ask you to explain a little bit about what that is and how it will benefit them, because I get the idea that what you are all about here is building hope for folks.
Absolutely. And, people often look at eyes or take eyes as a distinct part of the body when it's actually not. It's part of the entire human body. And our eyes are literally a window into the rest of our health. I've had patients who we have seen that had, they came in for blurry vision, and turns out that they may have a tumor in the eye, or they may have a blood clot that we can see in the eye first, and we alert their physicians as to the presence of this blood clot, and they get workup done and find that they have blood clots elsewhere, and it saves their life. So people misunderstand the connection between the eye and the rest of the body, and that's why we came up with the title Healthy Eye, because the eye exams can be so crucial. And this is all, again, part of hope, because when people come to you, sometimes the eye is the first time they actually have a symptom. They say that 1/3 of diabetics have diabetic retinopathy before they actually get diagnosed with diabetes. And oftentimes they come into our office with blurry vision, and they say, oh, I just need glasses. And people often have a misconception that glasses will take care of it. And they come in, we do a complete examination and find that they have unusual changes from diabetes, whether they have bleeding inside the eye or swelling inside the eye. And that sometimes can be the first sign. And we then take that information and discuss it with their primary care doctors and make sure that they make that complete circle and get the appropriate health care that they need to prevent major complications. So often the eyes become a good benchmark for the whole body.
Yeah, I remember a TV show that you did together with Joe, and you were talking about a situation, to me at least, it sounded like you probably saved the lady's life, because you identified a situation that if had not been properly diagnosed, she could have had a stroke or something like that. And it was all just through the process of going in to look into her eyes.
Absolutely. And this is one thing I want your viewers to understand, is that getting a good comprehensive eye exam is super critical in maintaining overall health. And, an eye exam done properly can literally save your life.
Yeah, and I want to ask this question. So you hear about places, maybe in a shopping mall or something, that you could go see an eye doctor and get a prescription for glasses. But from what you're discussing, it seems much more wise to invest that time and go to a place where you're really going to get your health of your eyes examined, not just some numbers on a piece of paper. Am I saying that in a right way?
No, I think you are correct. And there's a place for every kind of an exam, but a comprehensive exam where you not only get a pair of glasses, but you get your eyes dilated, and an examination is done by the physician of the back of the eye, is super critical for long-term care. Uh, there's a sad statistic. Even today, the American Academy of Ophthalmology has produced a statistic that says that 60% of patients that are diabetics that know that they need an eye exam either get the wrong kind of exam or don't get an exam at all. They skip an eye exam. Because a lot of these diseases, chronic diseases, don't have any immediate symptoms. People think that, you know what, I don't have any symptoms, my eyes are fine, I may be okay. And they can have microaneurysms, they can get the beginning processes in their eye and not even realize it because it doesn't affect their vision immediately.
Right. Well, and that seems like there's so many things that sound a little bit scary about that, which is why always is good to balance it with the word of hope. I would imagine, I think I was telling you a story of a fellow that we work with who's over in the Bahamas who just ran into, he's actually undergoing some sort of eye procedures now, but he's dealing with macular degeneration. And so I wanted to ask that question. Is that a diagnosis that always ends up with blindness, or what do you do when you get a diagnosis like that?
Absolutely. So, yes, it's a scary diagnosis. In fact, in patients over 55 years old, it is the most common cause of blindness in our country. And macular degeneration comes in two varieties: dry macular degeneration and wet macular degeneration. Either way, macular degeneration, like most things in the eye, if you catch them early, you can institute a program that can help slow down the degenerative process. Macular degeneration, for those that may not know, it's a genetic condition. You inherit from your parents, and you're going to pass it on to your children. And macular degeneration can be slowed down through vitamins and other things. For example, there's a very, very good study out there called the Airdate 2 trial, age-related eye disease study. It was an independent study performed by the National Eye Institute, funded by the NIH. And this is a non-biased study, and it looked at patients who were given vitamins to try to slow down macular degeneration. And what they found was that in majority of the patients that took those vitamins, macular degeneration was slowed down by these vitamins. And these vitamins are basically antioxidants. And you've heard of antioxidants.
Sure.
Antioxidants are a big buzzword because you hear them everywhere. Skin creams have them, and other vitamins and medicines have them. And they're designed to slow down a degenerative process, whether it's in the eye or in your skin or anywhere. And so these antioxidants are the first thing that a patient with macular degeneration is prescribed, because we want to start the process by slowing down these degenerative things. Once you make the diagnosis, as we discussed before, you tell the patient, look, this is not the end all be all. You're not going to go blind. The good news with macular degeneration is that you never go completely blind. Yes, people can lose their central vision, which is the most important vision that we have, but you will never lose your side vision. And so if you catch these things early and start a well scientifically based treatment program, then we are able to give hope to a lot of patients who didn't have hope before.
Yeah, I do remember that in some of the prior television programs that you've done with Joe, you actually, there's some good information about where you explained in good detail the difference between the wet and dry, and explained that the treatments are a bit different. Now, when you get into that and you have injections for treatment, is that something you do now for the rest of your life, or what does the program look like?
Great question. And it's funny, if you look at the faces of my patients, when I first tell them, I'm going to give you an injection in the eye, most people are just shocked and horrified. And they said, in my eye? And I tell them that it doesn't hurt. We numb the eye properly, but giving those injections in a timely manner is super critical in saving their sight. If you look at the studies produced with these injections, whether it's macular degeneration or diabetes or other conditions where we do these injections, the first few injections are critical. The first few injections that we give a patient can help set up their vision and their visual recovery for the rest of their life. Wow. And so these are time-sensitive injections. They have to be given in a timely manner. And once patients overcome their initial fear of
Mhm.
these injections, they do well. Now, I will tell you that most patients, over 97%, need injections for the rest of their life,
Mhm.
but they don't need them monthly. We start out initially treating them every 4 to 6 weeks, and
Mhm.
then we slowly extend the interval between injections. And that's called the treat and extend protocol. And that
Mhm.
is the gold standard now for treatment of macular degeneration all around the world.
Mhm. Well, and again, it just seems like with the technology and everything moving fast ahead, maybe the things that were true 10 years ago that might have been just it doesn't leave you with any hope. All these things sound like they're things that could be very beneficial and help you to retain your eyesight.
Absolutely.
So if we're talking about macular degeneration and somebody is being treated for that, here's a question about cataract surgery. Our own president and founder, Joe Steckler, as we were talking about before, not only did he have cataract surgery, but he actually wanted it filmed because he wanted the viewers to understand this isn't as scary as it sounds. And so I think one of the things that is probably useful whenever we do these kind of television programs, as a part of what we do as helping seniors, is we want to get people to become acquainted with issues that really impact the quality of their life and to understand that understanding that is probably a key to working your way through it. But if we come back to cataract surgery, connected when you have another item like macular degeneration, how does that work?
It's a good question. And I get patients ask me whether cataract surgery will change their macular degeneration or affect their macular degeneration. There are now good studies that have been published that show that macular degeneration is not made worse by cataract surgery.
Okay.
So, anybody that has macular degeneration should have cataract surgery. In fact, patients with macular degeneration need as much light in their eye to be able to see
Hmm.
as they can afford to get. And as our cataracts grow, the lens starts to turn brown, and it limits the amount of light that enters the eye. And as that light gets limited entering the eye, it becomes more difficult for somebody with macular degeneration to read,
Okay.
even if they had decent enough retina to be able to read. And so, cataract surgery is a good idea for people with macular
Hmm.
degeneration. Now, having said that, one of the questions that I always get asked is, well, doctor, what kind of lens should I have?
Hmm.
We are fortunate to live in an era where there are lots of lens choices that a person
Wow.
can make for cataract surgery. And many of these lens choices are expensive because the insurance doesn't cover them. They're considered
Ah.
cosmetic lenses. And so I often get patients who get sent to me and they say, well, I spend $2,000 for a lens and it's not doing what it should do. And oftentimes we find that it wasn't the right type of lens for
Ah.
this kind of patient. And so one of the things that, based on that, one of the things that we have started a program, it's called pre-cataract. And that means that a patient who is considering cataract surgery comes to us to get their eye evaluated
Hmm.
and the retina evaluated, and we can determine based on that whether they're a candidate for one of these fancy, expensive lenses.
Uh-huh.
As you know, many people that get cataract surgery are on fixed income, and
Sure.
so it's a lot of money to spend out of pocket
Yeah.
for a fancy lens that may or may not work for them.
Right.
Right?
Right.
And there's nothing more disappointing to spend $2 or $3 or $5,000 and not have the lens work.
Absolutely. No, I can only imagine. But here again, so I was thinking as you were explaining this from a layperson's point of view. We always have this. One of the things that we do as helping seniors is we have the Helping Seniors information line. That's a free number that people call us. And since this organization was founded, we've had over 2,400 families helped through the work of helping seniors at no charge. And that's thanks to the people that work and support the work of helping seniors. But one of the things I discover is whenever we take a call, somebody calls in with one particular question, but as we go through the discovery process, we understand there's multiple things that are going on. A person may call in. It could start with there was a particular financial situation, but then as you work through, you find there's other things that are involved. I was kind of as we were talking about this question about cataract surgery and I imagine that becomes one of the reasons why it's so important for somebody to get that comprehensive eye exam because they may walk in and may be complaining about one thing like, well, my glasses aren't quite right. But as you go in, you're gonna be able to evaluate and help them identify the things that need to be addressed that would then improve their quality of sight.
Absolutely. And I think this is where, we talked about the original, Healthy Eye program is people oftentimes associate an eye symptom as being something that they just need to adjust glasses or contact lenses. Blurry vision is a very common symptom.
Sure.
But blurry vision can have many causes, everything from a cataract to macular degeneration to tumors. I had a patient who actually had an eye exam for blurry vision and was given a pair of glasses. And unfortunately, it was one of those exams where they did not dilate the patient well. And the patient came in for a second opinion because the glasses weren't working for her.
Sure.
And lo and behold, we discovered that she actually had a tumor in her macula that caused her vision to be blurry. So yes, her eyeglass prescription was changed, but the reason the glasses didn't work because they had a different cause of blurry vision than just plain old glasses.
So I'm going to come back and I want to ask a question like, so how often should a person who doesn't necessarily think anything's going on, how often would they come or should they come to see and get an eye exam?
So the American Academy of Ophthalmology has these guidelines of when should somebody get an eye exam. And so for normal, healthy people under the age of 40, 45 years old, there's nothing wrong with their eye, there's no strong family history, then getting an eye exam, every few years is reasonable.
Okay.
If somebody has a strong family history of something like, say, for example, glaucoma, macular degeneration, other conditions that may have a genetic predisposition for the patient, then they should get an annual eye exam.
Okay.
If there's something found that needs to be followed closely, then it should be followed appropriately. There's a fine line between, one of the things that we as physicians are tasked with and should keep in mind is the cost of the healthcare delivery, right? And this is a very important topic, not only for patients, but even for physicians. You want to be able to take care of a patient and see them frequently enough, but not so frequently that it becomes a burden on them or the burden on the healthcare system. And so, a lot of these guidelines already exist. And, most physicians are pretty good at following the standard guidelines of what should be done. And patients can access this information. We live in an era where everything is available online. And so, these preferred practice patterns and these guidelines are available. Now, that doesn't mean you believe everything you read on the internet. And as a physician, I make a determination at the time of the visit to determine if I need to see the patient in 2 weeks, 2 months, 2 years, based on what my findings are. So, a guideline can't, take place of a physician's role, but this is where the eye exam comes in, where a good eye exam and a competent physician can help determine what's the appropriate time to get these things done, the test done.
Oh, it makes perfect sense. Now, one of the things, when you read the news headlines, it's so funny how different things will pop up because like we were just talking about, everything seems to be adjusting and improving with technology as we go along. But I saw something in the news that says an eye exam may have a relationship with predicting Alzheimer's early on. So explain that. This goes back to, I think everything's interconnected, but what does that mean?
Well, that's a great question. In fact, I had a patient today who brought up the very issue because she read this recent article that was out there. So, as we talked about before, the eye, the retina, which is the back part of the eye, that is part of the brain. It is interconnected to the brain. These are the exact same nerve cells that are in our brain. So neurodegenerative diseases of the brain can often manifest themselves in the retina as well. So Alzheimer's being a neurodegenerative disease, the nerve cells of the brain are affected. Well, they're finding that the same sort of changes that are happening in the brain are happening in the eye. Well, being the way the eyes are, a retina specialist like me, we can look in the eye and look at the retina clearly, and we can measure things very easily versus someone who has to have a CAT scan and MRI to look in the brain. It's a lot easier to do it in the eye. So what they're finding is that with patients with Alzheimer's, the blood vessels that are in the retina are affected very much like the blood vessels that are affected in the brain. And so by examining the retina, by measuring the blood vessels in the retina, we're able to pick up patterns of blood flow that may resemble Alzheimer's in the brain. There's actually two, and this was a article recently published out of Duke University in North Carolina. There's another test being developed for Alzheimer's for the eye doctor. And this is requiring a special dye that's being tested now. And I believe it's in Canada, and there are other places testing it as well. But this special dye can stain the very chemical called amyloid proteins in the retina that are the exact same chemicals that are causing Alzheimer's in the brain. And by doing this dye test in the eye, in theory, we can pick up changes much earlier because we can see it much earlier in the eye than you can in the brain.
All the reasons to get your eyes really checked, and because, as you said, there's nothing to really be afraid of. In fact, there's more reason to be hopeful, even if you are approaching the whole thing with an understandably great sense of trepidation. We're basically out of time, but I want to thank you for being part of today's program. If somebody wants to get in touch, it's probably cbetterbrevard.com is a good place to start. Perfect. And you can get the phone number and everything and get started with your eye health at the Eye Institute. I want to thank you, Dr. Vaishnav, for being with us today, and thank you, viewer, for joining us on the Helping Seniors television program. Thanks for watching.
Thank you.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.